Hey everyone, welcome. Thanks everybody for joining. We'll go ahead and get started. So first, I want to introduce myself. My name is Amanda Hall. I am the Senior Director of National Campaigns here at dream.org. I just want to say how honored and how grateful we are for each one of you joining this campaign launch. We know that your time is very valuable. And we also know that this initiative is so valuable and we need each of you to be part of it. So thank you for tuning in and excited to see all the amazing things that we're going to do together. But I did want to give a little overview because if you're jumping on a webinar, I better tell you what we're about to do. So tonight we are officially launching the Public Health is Public Safety campaign. I'm going to go into more depth about the campaign, really give a view and landscape about what we hope to do, and all of us together. Again, we need each and every one of you. We're also so lucky to have some true experts here with us tonight to talk about drug policies and to talk about their real life impact. We have folks with direct experience. We have folks who work in the field, but regardless, these folks know what drug policies have done to our country and continue to do. And they also want to come together for better solutions. So we'll be hearing from some amazing folks from around the United States. And then we're going to talk about what's next. So we're going to talk about what the future of the campaign looks like, how you can get involved, and how we can truly reduce overdose and continue the push to not criminalize or incarcerate folks who use drugs. How can we really make a country that truly shows that public health is public safety? But before any of that, it's vitally important to us here at dream.org that we center ourselves on why this campaign is so important, why we're all here tonight. So August the 31st is International Overdose Awareness Day. So we put a call out to some of our Empathy Network members and other folks who support dream.org. And we ask you to submit pictures of your loved ones that you wanted to honor, to raise them up and really show the real life consequences of some of our drug policies and to honor their memories and make sure that we bring their spirit into this campaign and that we fight for policies that can help people in the future. So now I hope we all take a second and remember the ones that we've lost. And again, thank you to all of our empathy members, our supporters, who shared, I know, pieces of their heart with us to be part of this. And we really respect that and honor that. And within this campaign, we always want to make sure that we humanize this issue. Unfortunately, every 5 minutes, we lose someone to an overdose. And right now, we are at a very pivotal moment in states and in cities around the nation. Politicians are pushing harsher laws to criminalize. Unfortunately, we see that that does not work. Another statistic is that after leaving jail or prison in the first 2 weeks, you are 27 times more likely to die of a fatal overdose. So it's so important because you may ask, why is Dream.org doing this campaign? They do criminal justice, they do climate. The overdose deaths affects us all, and it definitely affects folks who have been caught up in our justice system. The Public Health is Public Safety campaign is all about changing that. It's bringing diverse folks together, just like you'll see from some of our presenters tonight, just like you may have seen in the couple of webinars that we had before this, and what you'll see in the future. We want to bring together directly impacted folks, people who use drugs, people who are in recovery, people who practice harm reduction. We want to bring together academics, folks that know this issue, that know the evidence, that know the facts. We want to bring together law enforcement that are open to working on things in a different way, that promote things like deflection and community response to give folks the help they need, as opposed to incarceration. We want to bring together healthcare providers. So often, even folks who overdose maybe aren't offered the proper care that they need after that. We want to bring together folks that work in education, because unfortunately, our children are dying at alarming rates. We want to keep a lens on racial equity. You know, around the nation, overdose deaths finally started to drop this year, but not in communities of color, particularly Indigenous, Black communities, the Hispanic community. Overdoses are rising. So this is a huge task, and we need everyone to achieve it. We are about solutions here. We are about solutions that our loved ones didn't have the chance to access. So just like that slide said, Now it's time for us to build something different. So that's what the Public Health is Public Safety campaign is. We'll be working in states and even some cities across the nation coming really soon. We're already working on some federal policy. So what we need is your help. That could be, maybe you want to tell your story. You want someone to hear you. Maybe you see a policy in your city or state that needs to be changed and you need support. Maybe that means you finally want to walk into a lawmaker's office and tell them what these policies really look like and then work with them to change it. So we need you. I can't stress that enough. So I wanted to make sure to give you all a chance often within this webinar, so y'all don't get mad at me, but to sign up and join the campaign. The first step is to take the pledge. Please scan this QR code. Mr. Harrison is going to drop a link in the chat as well if you don't want to pull out your phone and do it. Sign our pledge to join the Public Health is Public Safety campaign. Again, there's all kinds of chances to get involved. You can be a storyteller. You can work on policy. There's all kinds of great things that we want to do. And later, I'll talk about, again, next steps to the campaign and what that looks like. But please, please, please join the campaign. But, oh, we've doubled up. I'm asking you again already. So scan this QR code, join the campaign. I should do infomercials, but we really need you all. We want to do this good work with you, not for you, because I don't know what you need in your city. I don't know what you need in your state. I don't know what you need in your community, but you do. And we want to support that and work with you. We have some amazing guests that are going to talk about their experience with drug policy, even weave in some of their personal experience and why they're here with us tonight in dream.org and are willing to jump into this fight. A lot of them have been fighting it for a long time, but why they're willing to do it with a bunch of other folks. So I want to turn it over to the amazing Dr. Stacey McKenna at R Street Institute. I would give her a biography, but I would not do it justice. So Stacey, I would love for you to kick us off, talk about yourself, drug policy, and this campaign.
Thanks, Amanda. Thanks all who are here and folks who shared the amazing stories and photos for the video earlier. It's a little bit hard to feel like I have anything significant to add after that. So I'm a medical anthropologist by training turned journalist and independent scholar for a while, and I've been specifically working as a harm reduction policy scholar for about 3 years. And my journey to starting to do that, to becoming a harm reduction researcher and advocate, was not linear, but I think all the twists and turns along the way really give me some unusual insights into both the issues and the work. So, one of the things that I think is most relevant, right? Like Amanda said, someone's dying every 5 minutes of an overdose right now in the US. And working in harm reduction in the midst of this era of an incredibly toxic supply, I'm constantly reflecting on how different things are from when I used. So I started using methamphetamine when I was about 16, and I used almost daily with a few breaks of several months all the way through college until I did what most people who use drugs, or at least certainly what most people who used to start using drugs at a young age did, which was aging out at about 22 years old, right? But if we think about things today, folks have a lot fewer opportunities to either age out of chaotic use and into something that's much safer and healthier for them, or age out altogether because the supply is so dangerous. So when I look back at my experiences with drug use through the lens of someone who now works in policy and who spent more than a decade actively conducting research with folks who use substances, I see maybe too many things to share today. But two of the things that really stand out and I think are most relevant today, right, are this toxic drug supply and the role policy plays in that. And then what we can do to actually save people's lives. So with the drug supply that we're grappling with, I'm at a point today where I'm constantly proselytizing to my friends who increasingly seem to have teens in their lives that it's not the same as it was when we were teenagers and we were experimenting. Right? They need to understand harm reduction, never use alone, go slow, keep naloxone handy, all that. Because when I look back at my own trajectory versus what people experience today, I know that I had what is, it feels like good fortune, but is really the result of policy. Of using meth and other drugs in an era where even though you didn't know exactly what was in your supply, you had a rough idea, right? If I bought a bag of meth, maybe it was crank and maybe it was crystal, but it was some sort of stimulant. Today, research suggests that stimulant users, even if they're not looking to use opioids at all, have a 1 in 10 chance every time, 1 out of every 10 times that they use, they're going to get fentanyl in that. And so obviously the risk of overdose is really different than it was when I was young, when I was using. My colleagues today who work on the ground, who are providing direct services, conducting research with folks in active use, ones who remain otherwise connected to folks who are actively using, right? They've all lost loved ones, sometimes dozens of friends or loved ones in a year. It's mind-boggling, and they're all struggling every day with the trauma. But what gets me is that after more than 15 years in playing multiple roles in this field, I know that this problem didn't come out of nowhere. It's the direct consequence of what some people call the iron law of prohibition, right? So this illicit drug market in this country has never been trustworthy, but increased crackdowns don't actually save lives, even if that's what they're intended to do. It's not what research tells us they do. Instead, they make the supply more opaque. People don't know what they're getting. And they make it more toxic by incentivizing more potent versions of what we get, right? So this is how we got fentanyl. Then we're potentially starting to see nitazines and other new adulterants in the supply. Increasingly toxic, not less toxic. And they even discourage people from taking the steps that could save their lives, like slowing down to use just a little bit at first, right? If they're scared of arrest, they might consume more quickly. So what this means is that drug use in the US is increasingly risky for everybody. That doesn't matter if we're talking about a teenager who's experimenting, if we're talking about someone who's been using opioids for 40 years, if we're talking about someone who's taking prescribed opioids for chronic pain and their physician cut them off suddenly, or someone in abstinence-based recovery who hit a rough patch and relapsed. It doesn't matter. It's more dangerous for all of us. And that means it's more harmful for our entire community, right? Because people who use drugs are part of our communities. So as much as I love being a researcher, I realized that my participants' lives were constantly being derailed by drug laws, often in ways that I had been mostly immune to when I was using. I was a middle-class white girl living in the suburbs. My life looked really different. And so I had the privilege to use out of sight and to make mistakes without major run-ins with the criminal justice system. And what I found in about 5 years of ethnographic research was that over and over again, having a criminal record, not just drug use, often much, much more so than even very chaotic drug use, having a criminal record is what was messing with my participants' abilities to get a job, abilities to have housing, even sometimes their ability to quit when they wanted to quit using. So as much as I loved the field work of my job, I wanted to do something that would more actively serve the folks who had privileged me by sharing their stories with me over the years. And that's how I got into policy research and advocacy. And today, a big part of the work I do is getting to write op-eds with wonderful people like Amanda to try and talk about this issue to a broader audience. I work with an organization that promotes free markets and limited effective government. So we really focus on the fact that harm reduction is going to save lives right now. And it's a solution that's pragmatic, that saves communities money, right? And most importantly, right, it gives people the tools to stay alive and as healthy as they can today. Pretty much as soon as most of these interventions start rolling out, they start making a positive impact in people's lives. So I focus really hard on solutions that are proven to save lives with decades of research, and trying to reduce government barriers to everything from naloxone distribution to syringe services programs to methadone access. I try to frame or reframe, I should say, the overdose crisis as something that affects all of us, our entire community, right? And continuously remind people that people who use drugs aren't some distant other, but we all share space, we all share family, we all are part of the same community. So I'm super honored and excited to be part of this launch for the Public Health is Public Safety campaign. I think it carries a message that's so in line with the work that I do. And we really, really need to recognize that whether or not we want to be able to arrest our way out of the overdose crisis, it's not effective. And if we want to save lives and keep our loved ones safer, keep our communities safer, harm reduction is a way more effective way to do everything from keeping needles off the streets, promoting less chaotic drug use, supporting recovery for people who want it, reducing disease transmission, you name it. There is a harm reduction intervention and a policy that can somehow support it that will be more effective at supporting our communities than overcriminalization has been. Thanks, folks.
Thank you so much, Stacey. And again, we're so glad that you are part of this campaign. Like I said, we love to partner and have broad coalitions. So your experience, all of your research, your policy knowledge, you all have to stick around just because Stacey's our friend and can help us with so many great things. So thank you. And I did want to echo that as Stacey mentioned, I also was a person that used drugs. I'm in recovery, the recovery that best fits me. And that looks very different for everyone as well, y'all. But I could not imagine if I still use today without harm reduction resources. I mean, I wouldn't be here. I wouldn't be able to even be on this webinar with you all. So even folks in recovery, I have Narcan sitting right beside of me. So even folks in recovery, I hope that we'll keep joining on board for harm reduction. There goes Harrison. Here's the Narcan. Keep it handy, everyone. Folks in recovery throughout that spectrum that we promote, we uplift harm reduction services. We love people who use drugs. We continue to push for public health policies and solution as opposed to carceral ones. So again, a big broad bench, and we need all of you all. Now, someone who is definitely with us in the fight and has some great experience and a unique perspective. Again, I do not think that I'm even worthy of talking about Robert Wood's experience and given his bio, so I'd rather let him do that. But Robert, I would love for you to talk a little more about your work, your experience, and why the Public Health is Public Safety campaign, why you're here with us today for the launch.
Well, no problem at all. First of all, I say you are definitely worthy to speak on me. I really appreciate you having me here, and thank you everybody for showing up. So I'm going to give you guys a little bit of background on me first, right? And then I'll dive right into what I'm doing these days. So I was a person who was involved in gangs, drugs, the streets from the early age of about 13 and a half, 14 years old, all the way up until I was in my 50s, right? My criminal career culminated in me being sentenced to 25 years for conspiracy to distribute 20 keys of crack cocaine. When I got that 25 years, I told myself in order to make the change necessary to get out and be a productive person and really embrace my family and the community, it was going to take a couple things: education, a great relationship with God, and helping other people, actually becoming more humanized through helping other people. And so when I got in there, I began to become a tutor GED students. I started going to college. I tutored college students. I signed a lot of people up for school, and dealt with a lot of different people in that context. In the process of going to college, I ran across an organization called the Prison Scholar Fund. They funded my education while in there, and now I went from being their social media advisor to becoming their senior social media advisor to being a part of their board of directors. In addition to that, while I was incarcerated, I was the team leader for an at-risk youth program within Lompoc Federal Prison called the START program, Start Taking Alternative Route Today. And I taught many volunteer classes, screenwriting, public speaking, taught within the psychology department, within the education department, did orientation, worked full-time, went to school. And that's how I changed my life. Now, my indictment was a gang indictment. And when I got out, I said, you know what? I owe something to all these communities where I have leveraged harm. And in order to do that, I had to get out and I had to volunteer to help people. I had to help people that weren't part of a job orientation or anything like that. I just had to get out and get really involved in the community, right? At the time, I was waiting to get out while I'm doing all this studying stuff. I meet a guy named Weldon Angelos. He's one of the foremost cannabis advocates in the country. And at the time, he was a big part of Dream.org, with not Dream.org, excuse me, Cut 50 back then, with a guy named Lewis Reed as the CEO. I was in there serving a 25-year sentence, wanting to get out, looking at every new law that came, jumping on it, asking, why isn't somebody helping us? People write about this stuff, they talk about this stuff, but nobody's helping us. And Weldon got out and he said, man, I want to introduce you to some people. He introduced me to the people at Cut 50, which stood for they wanted to cut 50% of the prison population. While I was in there, they had a spice epidemic. Spice is fake weed. There were a lot of people using that, falling out, passing out, blaming their heads. We thought it was the worst thing we had ever seen. Then we started hearing about fentanyl. President Donald Trump actually declared war on fentanyl when he was the president, and it continued on through the Obama administration, the Biden administration. It was something that everybody on both sides of the aisle agreed was getting out of control. It was actually killing people, and it was doing it in very short order. And so when I got out, the first actual job I had was working for Shafat Outreach, first full-time job. I did some stuff with other people, but working with Shafat Outreach. And then I was a volunteer board member for the Prison Scholar Fund, right? Did a lot with Dream.org. So in the capacity of me being what they call a community-based public safety professional, trained to do gun and gang violence interruption, I already had ran across a lot of people that were incarcerated with me that were using drugs, that were addicted. We had AA, we had NA, we had CA, we had all the programs in there for them to get help. But sometimes that level of help in a group setting just wasn't enough. What to do. People started to talk to each other about the help they needed. There were people serious about getting off of drugs, but at the same time, a lot of people, when they got out and hit the environment, it was just crazy. The drugs were there, all these different stimuli, and they started using again, right? And when they start using again, they don't, they don't realize how much stronger the drugs are. Most people that overdose on fentanyl do not know that there's fentanyl in what they're using. Let me repeat that. Most people that overdose on fentanyl do not know that it's in what they're using. They put it in cocaine. They put it in heroin. They put it in methamphetamine. They even put it in pills. And so people get these different pills, these Percocet, these all these different pills that they get, and the cartels take and interject it before it even gets to this country, right? And so it's pretty heavy because when you thinking, why would this person be using fentanyl? In most cases, they're not doing it knowingly. And so in my job capacity, doing gun and gang violence interruption, I ran across a few people who were in the process of overdosing. I have homeboys who have overdosed. I've met people and said, oh man, that youngster who I was a mentor for, I just heard he overdosed. Sometimes they live, unfortunately, sometimes they don't make it, right? And when they do convict somebody over the overdose crisis, they convict the drug dealer. He's not the person who put it in there. He or she probably did not even know that it was in there, right? And so that's something that we want to think about. This is not a situation where people always go in with their eyes open. And because of that, there is a horrible thing that I like to call the addiction to prison pipeline, where people who are addicted are in prison. They don't get any help other than the volunteer meetings they go to. Some people need a higher level of help, right? Some people don't need just to go to the meeting. That's not enough for them. If you keep going to the meetings, it usually works, but sometimes that's not enough. But they don't get a lot of help beyond that. And so when they come home and they're all excited about being back in the community, a lot of times that excitement turns into depression as things don't work out the way they want them to. They get back in the streets, they start to use drugs. Some of them are actually using the fentanyl itself directly. Others are using other things. As Amanda had said earlier, they're 27 times more likely coming out of incarceration to overdose than anybody else in society. And so with Dream.org, an organization that's addressing criminal justice reform issues, I would say that that's one of those issues. We have to get those people help while they're in there, more help while they're out there, and we need to concentrate more on education than incarceration. And one of the things we can do right now is educate people on this stuff. Narcan, right? What that does is that helps stop overdoses. It's the only thing known to stop a fentanyl overdose from being lethal. It doesn't always work, but it works a large percentage of the time. Now, I would like to sit here and tell you how to use it, but I'm not qualified to do that. I didn't get certified to train people on it. I'm just certified to let you know it's there. There are lots of organizations that you can go to. Usually when you're in a community, it's the public health department that will do it. Sometimes you may have to go on the county.gov website, but get some of this, keep it in your car, and when something goes wrong, you'll be in a position to help people. I keep it right in my car. I keep some in my house, but I keep at least 2 to 3 of them in my car. So if I run across somebody who's going through it in the process of doing what I do, I'm able to say, here, administer it, and I've had some pretty good results, right? Sometimes you get there, it's a little bit too late, but at least you have the option. At least you're not running around with your head cutting off saying, who has some of this, right? And so that is one of the ways that we can stop it. The other ways we can stop it is by bringing more awareness to it and advocating and joining Dream.org's campaign to help with these health and safety problems. Thank you.
Thank you, Robert. And thank you for that plug for Narcan. And I really appreciated how you talked about the longer drug sentences that are happening. So unfortunately, and along our campaign, we'll dig into this a lot more, but drug-induced homicide bills are popping up, and bills to further criminalize drug trafficking, drug usage, even folks who are unhoused all around the country. The drug-induced homicide bills popped up in over 30 states in the last couple of years. So not all of those passed, but it really shows you that some folks in very high positions think again that criminalization, incarceration is going to fix this problem. I can't help but think of a heartbreaking story out of Tennessee of 3 teenage girls who all used drugs together. I mean, I won't ask for show of hands, but I bet a lot of folks on here when they were teenagers, or maybe today, have used drugs and used them with your friends. Well, unfortunately, 2 of the girls passed away, and the other girl was charged with murder. And obviously, these were kids experimenting. So even we're losing so many people due to overdose, and then we're losing so many people once again in our carceral system. Something we definitely saw back in the 80s with the crack epidemic, and we'll also sign up for our campaign. We'll be doing a call around that and how, unfortunately, history is starting to repeat itself. So in this, there's so many different things that we have to tackle, from overdoses to criminalization. But again, us coming together, this is the only way that we can do it. So here we go with my telethon voice. But I do want to give everybody a second to take a breather, take a little, just a 2-minute break. But in the meantime, while we wait for our other 2 amazing speakers and then talk about the future of the campaign, again, take the pledge, join the Public Health is Public Safety campaign. Tell us that you are with us and ready to fight. And yeah, so in 2 minutes, it's 6:41 Eastern. So in 2 more minutes, we'll hop back on and keep going. All right. Thank you all. And I see in the chat, people are signing up. People are sharing on social. Please, please, please continue to do that. When you sign up, you can join our Slack channel. We'll keep you up with news, give you great graphics to share. We'll have some amazing storytelling coming up. But yeah, I appreciate y'all. Keep it up. Okay, now I want to introduce you all to someone who I am truly inspired by, her strength, her resilience. So again, I don't want to give all of Lachandra's bio because she can absolutely speak for herself, but I do again want to tell you how much I respect her and how important her voice is on this issue. And all parents who have lost loved ones are in this fight to push for better public health solutions as opposed to incarceration. But I want to pass it over to Lachandra Moore from Arkansas.
Hello, everybody. Thank you, dream.org, for having me. Thank you, everybody that joined in on the webinar. My name is Lachandra Moore, and I am the mother of 4. I'm a grandmother of 9, and I am a fierce advocate for fentanyl awareness. In 2021, I had to bury 2 of my adult children 4 months apart due to fentanyl poisoning. And I know a lot of y'all may be saying, why is she saying poisoning? Why is she saying poisoning? Because, like Robert said, everybody that is using fentanyl, everybody that dies from fentanyl does not know that they have been given fentanyl. My children were both taking pills. I went to prison in 2009. I did 3 years in prison. I used to pop pills and do everything I wanted to do instead of trying to get rehabilitated so I can come back out and be a productive member of society. I stayed out for 1 year, went back to prison, did a 6-year bid. I went back in 2013, I did a 6-year bid. In 2016, I was sitting in the day room looking at TV. And I saw on Dateline or somewhere where Prince had died from a drug overdose. I couldn't believe it. Because see, I had planned on, I was going to pop me some more pills when I get out because it didn't get me in trouble anyway. Pills didn't get me in trouble. I like to pop pills. And plus, it was recreational back when I used to do it. It's not safe now. So they came back a few weeks later and said something about the pills were laced with fentanyl. Oh my God, I was taken aback. I said, I promised myself I would never pop another pill in life. And I kept that promise. I got out of prison in 2019. I came home, trying to adjust to everything that was going on. I had a son, my son Roderick, he was in prison. And Deja was my baby. Roderick is the oldest, Deja is the youngest. I came home and I saw a lot of people were dying, from overdose. And I'm like, what is going on? And I realized that there was a problem on the streets. Because when you see things on TV sometimes, you feel like it's far off. That ain't affecting me, right? Yeah, well, it did. I found out that my daughter was popping pills. I didn't really make a big deal out of it because I used to pop pills when I was younger. It was recreational. But we had a problem. I noticed that we had a problem. They're lacing all the pills with fentanyl and people are dying. Like it's hitting closer and closer to home. So I watched the last 6 months of my daughter's life just, wow. I call it going down the drain because it didn't get any better. And all the praying I did and begging God to help my child and help me. Finally, I started asking God to give me the strength because I knew that something was going to happen. And I told Deja I felt like that. Now, mind you, my son is in prison. I'm not knowing all of this is going on. Anyway, I came home from work on April the 5th, 2021. I walked in the door and I found my daughter slumped over between the couch and the ottoman. And I ran to her and I grabbed her and I was shaking her and trying to make her wake up, begging her to wake up. She didn't move. Now, I didn't even have any Narcan because I didn't know to have Narcan. Maybe if I had Narcan, I could have saved my baby. 4 months passed, I'm going back to work. I'm on my way to work and I get a phone call that my son had died in prison. And I couldn't believe it. I was not going to believe that. I said, God, I know you ain't doing this to me. This can't be true. Lo and behold, it was true. After I had to bury my children, y'all, it was like late 2021. It sparked a flame in me. But I was sitting around trying to cope and deal with what was going on. Now, let me back up because I have 2 other children that are looking at me. We trying to figure out what's going on. How are we going to fix this? Now, I didn't know that I should have grabbed my babies up and took us to, we should have went to grief counseling. We should have gotten some kind of therapy. But in my community, we don't do that because we ain't crazy. We're going to talk to God about it and that's going to be that on there. That's not the case. I should have taken my children because see, they're still holding things in right now where I'm grieving and I'm healing. I'm healing because God put it on my heart to create a t-shirt brand and gave me the name, One More Kiss. I couldn't understand that at first. But if I could have just one more walk, one more talk, one more laugh, one more hug, share one more cup of coffee, I'll even take one more disagreement with my children. Just one last time. Just one more kiss. Wow. People didn't understand me. I've been accused of being crazy because I'm always talking about the dangers of fentanyl. I got on social media. I tried to market my brand. People wanted a story time. See, I wasn't even used to social media. I get on there every now and then, but people wanted a story time. So I started talking to them about what happened. And I saw this creator. He said that the governor of Texas was charging people with murder because they died by fentanyl and they were poisoned. From that moment on, I started saying poisoning. because everybody that's using drugs and die from fentanyl don't know that they are being given fentanyl. Some people know, some people want it, but it doesn't justify the fact that you're giving somebody something that will kill them. And you know it. You got to have a black heart to do something like that. That's what I always say. So I just started raising awareness about the dangers of fentanyl, and I'm talking about I can't stop. And all the time I'm doing this and crying and begging and pleading with people to please try to get some help. Try to get some help. My heart goes out to the addicts, the family of the addicts, because addiction does not only affect the person that's doing it. It doesn't just affect the addict, it affects the whole family. Ooh, Jesus, I could go on and on and on about this. But I just want to help people. I want to talk to the mothers who are going through the same thing that I was going through and let them know that it's going to be okay. We can make it through this. I have to. I have a strong need to do that. Now, y'all, all the time I'm getting on social media crying and begging and stuff. I'm healing. God is healing my heart. And I didn't know that he had bigger things planned for me. All I want to do is get the word out about this drug because I didn't know anything about it. And it's still, believe it or not, it's a lot of people out here don't know anything about it. But a lot of people, and I'm going to say this, in my community, a lot of people in my community, we sweep it under the rug because we're ashamed of it. And statistically, and I look today, it's killing more people in the Black community right now. People, we got to wake up. We got to wake up. It's dangerous out here. And so what I'm going to say in closing, I want to, it is my prayer. It is my prayer that everybody will take heed to what's going on with the fentanyl crisis and stop hiding it and talking about it. The more people speak out about it, the more people will believe it. And also, I want the lawmakers to put a MAT program inside of the prisons. My son was in prison when he died. And I need something to be done about that because they're going in there addicted to drugs. They're taking classes, running around doing all kinds of stuff. Like I said myself, I popped pills, did whatever I wanted to instead of trying to get myself together. They need to implement a program inside the prison to help these people get rid of the urge to want to get out and do drugs. Because if they go out there after being locked up and do drugs, you're going to die. Simple as that. Thank you.
Lachandra. And I have to tell you all, this is Lachandra's first time speaking publicly on a webinar like this. And when I met her, she said, I want to tell my story and people don't want to lift it up. I want to be an advocate. Like I want to, like she said, fight for programming for people incarcerated, fight for more mental health and resources in my community, fight against stigma, fight around education for fentanyl and more Narcan. You heard her. Like she has some solutions. So, I mean, Lachandra, I'm so grateful that
Miss
Ruby
didn't say everything I wanted to say.
Well, this is only our first one. You're in it, Lachandra. Like I said, we are in this fight together, and we need those parents' voices. We need those loved ones' voices. You all are impacted, and again, we all need you to join us. Oh, thank you, Lachandra. I can't wait for next time when you're here with us. All right, I'm gonna pass it over to someone else. I know he's thinking, oh my goodness, I have to go after Lachandra because she was just amazing. But I want to introduce you all to Mr. Alex Elswick, who he probably doesn't know it, but when it comes to harm reduction, when it comes to drug policy, he has had such an impact on me. And watching him and his work, especially in a state like Kentucky, and the way that he even teaches like our new generations around these issues and decreasing stigma and loving everyone, especially people who use drugs, especially people in recovery. He is just such an inspiration. So, Alex, I'm going to pass it over to you, and you tell us all about you, your work, and why this campaign matters to you, why you're here.
Yeah, thank you, Amanda. That's a hell of an introduction. I appreciate that. I want to make sure first to just acknowledge everybody who's spoken before me and shared their passion and shared their experience and their pain. And especially if you're doing it for the first time, I know that's really not easy, and that really takes some courage, and it really makes a difference. So I appreciate you all. And I also want to be sure to say thank you to everybody who's on the call. Looks like almost 70 people across the country. This is like what do you call it? Like a collective effervescence. Like I feel connected to people all across the country who are like-minded, who are having a similar experience. And the reason I appreciate you all is because the kind of people who are going to get on a call about drug war activism at, in my case, at 7 o'clock at night, are people who are awakened to the fact that something's gone terribly wrong. People who are aware that something's really not working, and that are really dedicated to making a change. So I appreciate that. My name is Alex Elswick. I'm an assistant professor at the University of Kentucky, where most of my research focuses on really the marriage between harm reduction and recovery, which is, I think, a nexus that we need to spend a lot more time focusing on. I'm also a co-founder of the largest recovery community organization in Kentucky, called Voices of Hope. And so we have nearly 100 staff, all who use their lived experience to help other people find a kind of recovery that works for them. And I will tell you that I used to tell people that I run Voices of Hope, and that's disingenuous these days, because we have a massive staff of folks with lived experience who are doing it all by themselves, which is really the most gratifying thing. But without a doubt, the most important experience I have is personal experience, because I'm a person in recovery, and that's how I came to harm reduction advocacy and to drug war activism. And so I want to share just a little bit of my experience and then a couple lessons learned, and I'll get out of your way. If you've ever heard me share my story before, I always start in exactly the same place, and that is by telling you that I grew up really privileged. I was born and raised here in Lexington, Kentucky, to such a privileged environment. Dad's a doctor, mom's an accountant, that whole kind of thing. But I inherited some risk factors, and a genetic predisposition. I have anxiety disorders. And when I was 18 years old, I was prescribed opioids when I had my wisdom teeth removed, and I got addicted to opioids. And it's probably not all that helpful that I tell you all the things, because you all already know all the things. I went in and out of jail on drug trafficking charges, and I went in and out of treatment, and I went on and off the street. I ended up under a bridge in Dayton, Ohio, really kind of living out the stereotype. But I got a 7th or 8th shot at treatment, and then critically, after treatment, I got an immense amount of help, like a remarkable amount of help. And it's astonishing to me sometimes that these days I get pats on the back and people say, Alex, you are in recovery because you're strong and you're tough and you're resilient. And I know they mean well when they say that, but none of that's true. I'm not in recovery because I'm strong. I'm in recovery because I got help. I got access to all the things I needed. And so that's really where Voices of Hope came from, was just this understanding that this privileged experience I had that made recovery so possible for me is not the typical experience. And so we wanted to kind of replicate that for other people. And through my personal experience, and through our work at Voices of Hope, and through my research, and I'm also a clinician. I was trained as a marriage and family therapist. So when you put all of that together, you learn some interesting lessons. And here are 3 that I think are important and that relate to the campaign. And the first would be, addiction is a chronic disorder. And in fact, I teach a class in the Lewis Honors College at University of Kentucky, and the title of the class is, you guessed it, Addiction is a Chronic Disorder. And that's a critically important thing to acknowledge, because if addiction is a chronic disorder, that means that it can't be solved with an acute response. So treatment might be helpful. It might be a period of crisis stabilization to get somebody headed in the right direction, but it's never sufficient. It's never the answer. And so as we continue to marshal more and more dollars and more resources into the same type of homogenous abstinence-based treatment, and the problem continues to worsen. The second thing I would say is the war on drugs has failed. You've heard that from every speaker before me, and you already know this. My favorite way to make this case is to show two graphs. I didn't bring them with me today, but if you look at a graph of incarceration over the last 50 or 75 years, and you see that exponential rate of increase, the only way that we can swallow that and say that's acceptable to us is if there was a commensurate decrease in drug use, in drug-related harm, in overdose, right? Then maybe we would say all of this incarceration might be a pathway we would consider. Of course, if you look at a graph of drug use over that period of time, it's a horizontal line or worse. We're now mired in an opioid overdose crisis, and we lose 100,000 people a year. Obviously, the war on drugs is not working. And to take it a couple steps further, even some of the things, the tactics, war on drugs tactics that we might assume are effective are not. And one of the best examples of this, to my mind, is drug seizures. We've all been led to believe that every night on the nightly news, when we see law enforcement standing next to a table full of drugs and guns, and they say, no one's going to overdose on these drugs tonight. And that's true. They got those drugs off the street tonight, but they didn't get all the drugs off the street tonight. And they actually didn't make our communities safer because they got those drugs off the street tonight. Recently, some researchers published what's called a spatiotemporal analysis that looked at following big drug seizures, rates of overdose 7, 14, and 21 days subsequent to the seizure. And what they found is following big drug seizures, there are inevitably sharp increases in overdose. And the reason for that is because it creates all this disruptions in the market, all this instability. Now, people who already had a relationship with a person from whom they bought drugs, they can't go there anymore. They have to go somewhere else. They buy contaminated drugs. They buy weak drugs, and then they buy more, et cetera, et cetera. I think that, to my mind, that's always a really stark example that the war on drugs is not harm reduction, it's harm production. We quite literally can show through the research and through the data that these strategies are producing harm. And then another talking point that I had noted earlier that multiple people have already spoken to is the notion that people, the misconception that people are safe when they're incarcerated. And I hear it so often from people who work in the field. I hear it from sometimes so-called experts in our space. And I certainly hear it oftentimes from family members and loved ones who say, well, at least my loved one is safe when they're incarcerated. And we know that that isn't the case. And so if we know that we can't keep drugs out of our jails and prisons, then what on earth makes us think we can keep drugs out of our communities, out of our societies, right? So if the answer can't be treatment alone, if the answer can't be incarceration, what is the answer? I don't know that I have the answer alone, but certainly it involves things like recovery-oriented systems of care, which means giving people freely available access to the recovery capital that they need, all those resources that promote recovery, the housing, the mental health services, the employment, et cetera, but importantly, it means giving them access to that recovery capital, those resources, without the precondition of abstinence, without demanding that people become abstinent first in order to access mental health services, in order to access housing, in order to access treatment, in order to get compassion, in order to be treated as a dignified human being. You know what I mean? The results of your 12-panel drug screen don't determine your dignity as a human being. They certainly don't. It also means doubling down on harm reduction. For my part, if you put me in charge today, and nobody's going to, so don't worry, but if you put me in charge today, I would have the dollars that we're spending on treatment and put those dollars into harm reduction for many of the reasons that you heard today, because it saves lives now, but also because critically, as I told you about this nexus between harm reduction and recovery, harm reduction is a pathway of recovery. It's a pathway of recovery, and I see it every single day in the work that we do. And so often the way that people describe harm reduction, it's like a last resort, or it's what we do when we're giving up on people who just won't get abstinent, and nothing could be further from the truth. So many people's journey that might even end in abstinence, it may not, but it may, begins with harm reduction, begins with meeting people where they are and connecting them with the resources that they need. And then lastly, it means supporting all pathways of recovery. It means we got to get off our high horse about being the arbiters of whose recovery is good and whose recovery is bad. an improvement in quality of life is an improvement in quality of life. And to me, that's what matters most. So whether you're a person who takes an abstinence-based approach, or you use medication, or you use harm reduction, or you use non-abstinent pathway, you continue to use a substance and you use it in a non-problematic way and in a non-chaotic way, and you're able to meet your responsibilities and able to be a good citizen and maybe able to show up tonight as an advocate, that's more of what we need. So like all of the others, I'm sure I could go on and on, but I'll stop and I'll just say you all know what the message is, and the message is that public health really is public safety.
How lucky was I to really get to learn so much about harm reduction, recovery, loving people where they are from somebody like Alex Elswick. So I just had to, since I had that fortunate, I was that fortunate, I had to share it with you all. So thank you, Alex. She was like, that was so helpful. And I really, when you mentioned, and Jim put it in the chat, but that incarceration is not harm reduction, it is harm production. Jeez, I need like a t-shirt. That is pretty amazing. That's pretty amazing. And here's another shameless plug, but when you all sign up for the Public Health is Public Safety campaign, you read our mind, because on our official website, there's a graph of incarceration rates, and right beside of it, overdose death rates. So, yep, you can see it in bold print on a little graph that it is not working. So thank you, Alex, so much. All right, now, since we have all these super smart people with us, we want to give, well, first, don't forget, join the campaign, another plug, but we want to give you all a chance to ask them some questions. We have folks from a lot of different walks of life, a lot of different experiences. So Harrison mentioned it in the chat for Q&A. If you to use that Q&A button, if you don't want to use that, put it in the chat. At this point, I'm fine if you raise your hand. And after that, I'm going to talk a little bit about the future of the campaign, but I definitely want to give you all a chance to ask some questions. All right, we have a hand raise.
Wow, this has been so powerful. And I got on this. This was a setup. This was nothing that I expected. I read everything, but I would love to be on the campaign, because one of the things in working as a social worker, and especially dealing with parents, I mean, over years, 20-something plus years during the crap epidemic, the meth, everything, the one thing I found in treatment, if we don't deal with the root cause, because nobody wakes up one morning and decide they want to be an addict or their life is going to be consumed with drugs. And once we dealt with the root issue, and especially those who've been sexually abused, I found it was harder to really, with the recovery process, and we had to heal that. So we're so busy looking at the fruit, but we don't examine roots. And that's what I hope this whole thing is examining the roots, and the whole family, everyone that's a part of that person's life, have to buy into the recovery, be a support, don't be punitive, don't be codependent, all those things. So I think it has to be a holistic and a whole. Everybody from 0 to 90 has to be involved. And those are the ones that I saw that are very successful, because recovery can be a lonely road.
Oh, thank you.
Thank you.
Oh, thank you so much for those comments. And yes, please, we need you in the campaign. We need those social workers. We need those family advocates. We also want to do some advocacy around youth, and we'll have some great experts soon. And even, in Kentucky, we have a Public Health is Public Safety campaign. And at every event, there's a panel just devoted to youth, and we hear from youth. I don't know if a lot of folks remember DARE, but it wasn't successful. So what are other ways we can work on prevention, education? All right, great. We have another hand up, Kelly.
Hey, I wanted to know where I could access the information that Alex, was that his name, was talking about the spike in, did he say a spike in overdoses when there is a drug seizure or something like that?
Yeah, sorry, I was typing and trying to unmute at the same time. I just dropped my email into the chat. If you want to just shoot me an email, I'd be happy to send you the research so you can check it out for yourself. It's really fascinating, really important research. And actually, because reading, academic literature can be pretty dry, there's actually a Narcotica podcast where the researchers talk about this research, and that might be a more interesting way to learn about it. So if you want to shoot me an email, I'll get you hooked up.
Okay, thank you so much. I'll probably want both the
Okay, cool.
academic research and the pod. Thank you so much. Appreciate it.
You're welcome.
Thank you, Kelly. Thank you, Alex. And Harrison has his hand raised.
Yeah, I have a question, Miss Amanda. If folks wanted to access resources like naloxone, Narcan, test strips, all that stuff, where should they begin? Leaving this call, what can folks tell their own community members?
So I have one plug, Sonoran Prevention Works. They're Arizona based, but they're one of the largest male providers of naloxone and test strips in the United States. So you can look up Sonoran Prevention Works on Instagram. They're on all of the social medias just under Sonoran Prevention Works, and they have a mail program. So they'll send you like massive packages of liquid naloxone, nasal naloxone, fentanyl test strips, xylazine test strips. And then likely someone just actually dropped a harm reduction resource thing, like a link as well. So you can find one near you. But most states have some sort of harm reduction organizations or public health organizations that will distribute those to you. But if you need like something in the immediate, Sonoran Prevention Works will mail them to you very, very quickly.
Yeah, thank you, Jay. Yeah, I know that policy and the regulations surrounding a lot of this stuff differ state to state, but I asked this client kind of just to get somebody from my team to offer some pointers. But yeah, I really appreciate everybody from Allison to Marcy to Lindsay dropping resources in the chat. I think if you don't know where to start, just begin with Google at least, and maybe your state and community. So yeah, I have often plugged Mixed Distro. Thank you to Matt, and also thank you, Brittany, for sharing some stuff too.
And if you are in a state where like strips or something are still illegal, we absolutely have resources that will get them to your area, regardless of legality, which I don't know if I should say this on this call, but guerrilla type harm reduction has been a thing for many, many decades. So I'm sure it's fine to say.
Perfect. Thank you all. And look, that like whole theory of everybody working together literally played out in the chat. People were just bombarding with resources. And if testing strips are illegal in your state, hit us up if y'all want to work on it. And we got your back and support. That's a campaign that we worked on in Kentucky in a broad coalition. I see a lot of those partners on this call now, and definitely would support your work in your state too. Okay, are there any more questions? All right. Okay, so what's coming up for the public health is public safety campaign. I wanted to talk about that, why we use this amazing graphic for you all. If you haven't signed that pledge or on our campaign platform, you get another chance. But another reason why you would want to sign up, because every month we're going to do campaign calls. And we're going to do that based on a different topic. We'll also give policy updates, federal policy, even some states, but just a list of some upcoming topics that we're going to talk about in September. And we're adding the link. You can actually sign up for it right now. In September, it's National Recovery Month. So we're going to talk about that whole spectrum. And I think that Alex did a great job on talking about that. So whether you are on MOUD, whether it's abstinence-based, whether you use drugs, but your recovery is that it isn't chaotic use, or however that looks. Honestly, we get to define our recovery, and we need to be in community and support each other. And again, we have to quit stigmatizing what that looks like. So next month, our webinar will have a bunch of different folks. Our lovely Jay, who just hopped on with those harm reduction resources, is going to be our moderator. We're also going to hit on, because we do love us some policy around here, folks, we're going to raise up that it's the 30th anniversary of the violent crime bill, which you all have probably heard a lot back. But that federal legislation did a lot of things, one of which it really incentivized states to build more carceral settings, put a lot of money with law enforcement, and did it have an effect on our community-based resources? Why have we used so much money in the carceral setting? How does that compare to resources such as harm reduction, mental health? So we're going to hit on that some too. So that's September. In October, we're going to dig more into racial disparities when it comes to overdoses and drug policy. That's the month and the anniversary of the Anti-Drug Abuse Act. Folks might not know the name of that act, but it's where crack and cocaine sentencing disparity came from. It's literally one of the big players that devastated Black communities around the nation. We have to lift up that history. We have to lift up the folks that were affected. We also need to talk about what's going on currently. With all of these fentanyl laws that are being passed to crack down on people that traffic drugs, and I have to tell you right now, my offenses and what I was incarcerated for was drug trafficking. So we need to look at this, trying to put people in these different buckets, and people that traffic drugs, it's for a lot of different reasons. And even with that, is these long sentences making us safe? I would say absolutely not. I mean, I miss my child's first words while being incarcerated, things I'll never get back. But we're going to talk about how now with fentanyl, Black folks, communities of color are being over prosecuted. They're doing longer sentences. They're being incarcerated. So that webinar, it's really going to be a lot about history, but a lot about what's going on now that we may not know about, and how to change that, how to fight against that. In November, we're going to talk about overdose in our Native communities. We have some great partners that are willing to help us with this webinar and really dig into something that's happening that, honestly, I get on a lot of drug policy things and a lot of webinars or read a lot, and why we don't know what's happening in those communities, why we aren't supportive. You know, I know me, I will put on me, I need to do better. And I'm very excited to learn. And in December, I saw a lot of talk in the chat. It's Universal Human Rights Month. We're going to talk about overdose in carceral settings. Overdose is while you are incarcerated. Overdoses upon reentry. What can we do for the people that we love that are incarcerated? How can we be advocates? How can we make sure they have better resources? How can we make sure that they're stepping out with harm reduction resources as well, and referrals? So that's the next few months. In between, we're going to be working on a lot of policies, a lot of advocacy. Right now, you can go on over to the dream.org page, to the justice section, and even sign our petition to support the Restore Act. We have so many amazing partners in partnership with Drug Policy Alliance, who are geniuses in my eyes. We are working to advocate for and support the Restore Act. So years ago, unfortunately, there was a federal law put in place that said if you have a drug conviction your state can ban you from ever receiving SNAP benefits. I know for me and a lot of folks after incarceration, literally, I don't know how I would have fed myself without that safety net. So there are states across the nation, South Carolina in particular, a forever ban. You cannot receive SNAP benefits. You can't receive that help, which affects your family. And in other states, there are modifications, which often means you can't receive SNAP benefits. If we're trying to help reduce overdoses, help our neighbors, we can't continue to stigmatize. We can't continue to lock people out. So go on over, sign that petition, get involved with that advocacy. But we're doing the most, y'all. And to do the most, we need your help. So please, if you haven't signed that pledge, sign the pledge. And I think this has been an absolutely amazing launch. We look so forward to where this campaign will go. Unfortunately, drug policy affects us in so many ways every day in our day-to-day life. So we have a lot of work to do. But I feel really, really fortunate that you all jumped on here because it gives me like a light at the end of the tunnel because I believe we can do it together. So that's all I have. I know it's a little early, but please sign the pledge. Join us next month. Share with your friends. And yeah, thank you all so much for being part of our campaign. We appreciate it.
And everybody, please feel free to come off mute, say good night, good evening.
Good night. Thank you.
You are all
Thank
Thank you.
Good
Enjoyed
night.
it very much.
Thanks, everyone.
God bless everyone.
Thank
Bless you as well.
Good night, everybody.
Good
Good
night,
night.
everyone.
Good night. See y'all later.
Good night,
Good night.
Ruby.